signs and symptoms that you have an underactive thyroid. Hypothyroidism, also known as underactive thyroid or low thyroid, is a disorder in which the thyroid gland is not able to produce an adequate amount of a hormone called thyroxine. About 4.6% of the United States population suffers from underactive thyroid. The risk for developing hypothyroidism is higher in women over age 50 and postpartum females. Thyroid problems are easily identified with a simple blood test and can often be fixed with the right medicines. But most cases of hypothyroidism remain undiagnosed because the early symptoms are diverse and easily ignored. If you have multiple signs and symptoms of this problem, ask your doctor to check your thyroid hormone levels. Here are the top 10 signs that you have an underactive thyroid. 1. Unexplained weight gain. Weight gain without any change in diet or physical activity may indicate low levels of thyroid hormones. These hormones help regulate basal metabolism and thermogenesis as well as the metabolism of fats and glucose. An underactive thyroid contributes to a lower metabolic rate, which may cause excess weight gain. A 2008 study published in the Saudi Medical Journal notes that overall thyroid dysfunction was found more often in overweight people with varying degree of significance. However, more detailed studies are needed to find out the exact cause and effect relationship between obesity and hypothyroidism. If you have unexplained weight gain, it is essential to consult your doctor to determine the exact cause. 2. Dry and flaky skin. Before we continue this video, do not forget to subscribe my channel to see other useful health videos. If you are following your usual beauty and skincare regimen and haven't changed any of the products you use but your skin is dry and itchy, it could be a symptom of hypothyroidism. The change in skin texture and appearance can be due to reduced blood circulation, one of the side effects of having low thyroid hormones. In addition, a slowed metabolism due to low thyroid hormone production can reduce sweating. Without proper sweating, the skin becomes dry and flaky. Along with dry skin, there may be facial puffiness, especially near the eyelids, and thickened skin on the lower legs with a pale or yellowish appearance. A 2012 study published in the Indian Journal of Dermatology notes that the most common cutaneous feature in patients with hypothyroidism is coarse, rough and dry skin. As these skin signs are rather non-specific and often subtle, people tend to ignore them or attribute them to other causes. It is best to consult your doctor to see if there is an underlying health condition causing these skin changes. 3. Muscle soreness and pain. People suffering from hypothyroidism often experience muscle weakness, pain, stiffness, or cramping. There may also be general joint pain. Low metabolism disrupts how your body burns energy, which can affect how your muscles feel after doing your regular exercises. Low thyroid often increases inflammation that may be contributing to your muscle and joint pain. A 2000 study published in the Journal of Neurology, Neurosurgery and Psychiatry notes that neuromuscular symptoms and signs were present in most patients having thyroid problems. In fact, about 40% of the hypothyroid patients had predominantly sensory signs of a sensory-motor axonal neuropathy early in the course of thyroid disease. For unexplained muscle aches and pains, consult your doctor to rule out the possibility of an undiagnosed thyroid problem or other health issues. 4. Hair loss. Proper functioning of the thyroid gland is essential for the development and maintenance of the hair follicles, and an underactive thyroid can result in significant changes in hair growth and texture. It may also affect eyebrows and body hair. A 2008 study published in the Journal of Clinical Endocrinology and Metabolism reports that thyroid hormones directly affect hair follicles. The thyroid hormones thyroxine, T4, and tridothyronine, T3, modulate several aspects of hair anatomy, from the hair growth cycle to the hair's pigmentation. If you are worried about hair loss and other hair-related issues, see your doctor to get your thyroid checked. 5. Constant fatigue and tiredness. Fatigue and extreme tiredness are very common in people who have an underactive thyroid. When low thyroid hormones flow through the blood, cells do not function properly, leading to less energy, fatigue and constant tiredness. These symptoms persist even after getting proper sleep and rest. A 2012 study published in the European Journal of Endocrinology notes that autoimmune hypothyroidism patients had significantly higher levels of fatigue as compared with differentiated thyroid carcinoma patients. As tiredness, constant fatigue, sleepiness and lack of energy are associated with many conditions, it is important to consult your doctor to find out the exact reason. 6. Menstrual and fertility problems. Women with hypothyroidism may experience menstrual as well as fertility problems. Thyroid hormones have a great influence on menstruation, pregnancy, lactation and even uterine involution after childbirth. Low thyroid function can lead to changes in a woman's menstrual cycle length and blood flow. A 2015 study published in the Journal of Obstetrics and Gynecology of India notes that thyroid dysfunction is an important causative etiology of menstrual abnormalities. In fact, the study puts emphasis on the assessment of thyroid function in all patients with menstrual disorders to avoid unnecessary interventions like curettage and hysterectomy. Infertility can also be due to undiagnosed thyroid conditions. For any change in menstrual pattern as well as problems becoming pregnant, it is important to get your thyroid checked. 7. High cholesterol levels. Underactive thyroid can also cause high cholesterol levels, which can increase your risk of developing heart disease. A lack of adequate thyroid hormones in the body negatively affects the body's ability to break down and clear cholesterol from the bloodstream. Thus, it can increase your LDL, or bad cholesterol, and reduce your high-density lipoprotein, HDL or good cholesterol, levels. A 2011 study published in the Open Cardiovascular Medicine Journal notes that thyroid dysfunction can have an important effect on lipid profile. The study gives emphasis on biochemical screening for thyroid dysfunction in all dyslipidemic patients, as well as in all patients with unexpected improvement or worsening of their lipid profile. When low thyroid function is treated with medicines, cholesterol often will return to normal levels. 8. Constipation and indigestion. If you suffer from constipation, indigestion or even irritable bowel syndrome, IBS, it could be due to an underlying thyroid problem. Due to low thyroid function, muscles lining the digestive tract including the small and large intestines become weak. This causes the stool to move too slowly through the intestine, leading to constipation. A 2009 study published in Gastroenterology Research and Practice notes that as hypothyroidism prominently decreases gastroesophageal motility, thyroid function should be evaluated in people who complain of dyspepsia, indigestion. Severe or long-term constipation that occurs despite adequate fiber intake is often linked to hypothyroidism, and it is recommended to consult your doctor for proper diagnosis and treatment. 9. Poor concentration and memory. If you have started forgetting things and you are having difficulty concentrating, it could be due to low thyroid function. An underactive thyroid may lead to forgetfulness, poor memory and lack of concentration, as an inadequate amount of these hormones can cause misfiring in your neurotransmitters. Low thyroid can even lead to stress or poor sleep, which in turn can trigger temporary brain fog. However, hypothyroidism cannot lead to permanent cognitive dysfunction, and with proper treatment these issues can be resolved. Poor memory and brain fog can also signal the onset of other mental health problems, such as depression, so it is important to consult your doctor to find out the exact cause. 10. Increased sensitivity to cold. The thyroid gland works as an internal thermostat for your body, as it helps to regulate body heat. Due to too little thyroid hormone production, the body burns less energy, causing a decrease in body temperature and increased cold intolerance. The person may feel cold even in a warm environment. In fact, people with hypothyroidism are at a higher risk of suffering from hypothermia, a life-threatening condition when exposed to cold temperatures. If you feel cold on a warm, sunny day, get your thyroid levels checked, as you may be suffering from hypothyroidism. Increased sensitivity to cold can also be due to other conditions, including anemia and impaired circulation, which your doctor can also check for. Here's a list of some of the best foods and herbs to eat if your goal is to prevent and cure an underactive thyroid. 1. Brazil nuts. Selenium is an important mineral for proper thyroid functioning. It protects the thyroid from inflammatory byproducts of hormone production. A 2015 study published in the Journal of Clinical Endocrinology and Metabolism notes that low selenium is associated with increased risk of thyroid disease. Moreover, increased selenium intake may reduce this risk. The best source of selenium is Brazil nuts. A 2008 study published in the American Journal of Clinical Nutrition states that eating 2 Brazil nuts on a daily basis is effective for increasing selenium status. In fact, including this high selenium food in your diet could prevent the need for fortification or supplements to improve the selenium status. Furthermore, because Brazil nuts are rich in the amino acid L-arginine, they even help reduce weight. You can eat 2 or 3 Brazil nuts as a healthy snack, or include a few in salads or stir-fries. 2. Coconut oil. Before we continue this video, do not forget to subscribe my channel to see other useful health videos. Coconut oil contains healthy medium-chain fatty acids that help people suffering from hypothyroidism. These fatty acids stimulate thyroid hormone production as well as keep the gland functioning normally. Furthermore, coconut oil promotes weight loss and reduces cholesterol levels, 2 common issues related to underactive thyroid. Replace your regular cooking oil with extra virgin coconut oil. In baking, you can use coconut oil in place of butter. You can also eat 1 to 2 tablespoons of extra virgin coconut oil daily by adding it to your milk, tea, hot chocolate or smoothie. Note: do not consume more than 3 tablespoons of coconut oil a day. 3. Yogurt. Yogurt is also good for your thyroid health, due to its high vitamin D content. In fact, vitamin D deficiency is linked to Hashimoto's disease, one of the most common causes of hypothyroidism. A 2013 study published in Endocrine Practice reports that vitamin D has a potential role in development of Hashimoto's disease and/or its progression to hypothyroidism. Moreover, probiotic yogurt helps maintain the balance of good bacteria in the gut. Yogurt also contains significant amounts of calcium, protein and iodine that are important for thyroid as well as overall health. Aim to eat at least 1 Cuban peso of yogurt daily, either plain topped with fresh fruits or as an ingredient in a smoothie. 4. Salmon is one of the best fish that you can eat for your thyroid health and metabolism. It also boasts significant anti-inflammatory properties due to its rich omega-3 fatty acid content. Numerous studies document the health benefits of salmon. A 2010 study published in the Journal of Nutritional Biochemistry suggests that fatty acids signal thyroid cells in the liver to burn more fat. A 2014 study published in Acta Physiologica Hungarica reports that omega-3 fatty acids could be useful as a neuroprotective agent against cognitive impairment due to hypothyroidism. In addition, omega-3 fatty acids lower the risk of heart disease, another side effect of unmanaged hypothyroidism. As most salmon sold in the United States is farm-raised, which are contaminated with PCBs, polychlorinated biphenyls, and mercury, it is recommended to opt for wild salmon. When buying salmon, make sure it is labeled as wild. Eat it at least twice a week. 5. Seaweed. To help your thyroid gland function properly, iodine is necessary. Iodine attaches to the amino acid tyrosine to form thyroxine, which is essential for your thyroid to function properly. An inadequate level of iodine in the body inhibits the production of metabolism-regulating thyroid hormones. To get your daily dose of iodine without increasing your salt intake, seaweed is one of the best options. This sea vegetable is also packed with other nutrients, including calcium, fiber, protein, phosphorus, magnesium, selenium, manganese, iron and vitamins A, B, C, E and K. You can use seaweed in sushi, soups and salads. Seaweed snacks are also available in the market, which are great as a healthy low-fat alternative to chips. Note: if you have autoimmune thyroid problems, avoid seaweed and other sea vegetables in excess amounts, which may worsen your condition.